Today, let's talk about sex during pregnancy. Is it okay or what is not okay? Has pregnancy spiked your interest in sex or is sex the last thing on your mind? Which other way? What you need to know about sex during pregnancy. Your developing child is protected by the uterus' powerful muscles and the amniotic fluid. If you don't have any health issues in the past during your previous pregnancy, the issues may include preterm labor or placenta issues. Having sex won't have an impact on your unborn child. However, pregnancy may alter your interest in and comfort level during intercourse. You may likely want to know, can a miscarriage result from having sex when pregnant? A miscarriage occurs when a pregnancy ends suddenly before 20 weeks of gestation. A miscarriage won't result from having intercourse while pregnant. The majority of miscarriages occur when the fetus isn't developing normally. After sex or an orgasm, cramping or spotting are frequent. However, get in touch with your healthcare provider if you experience severe cramping that does not go away or heavy bleeding that resembles your monthly period. Another question commonly asked by pregnant women or anyone concerned is, which sexual position are ideal for expectant mother? As long as it's comfortable for you, most sexual positions are acceptable during pregnancy. You may try different positions if one irritates you. Discover what works best for you as your belly grows. Remember comfort and enjoyment. Another question you might likely want to know is that, do you need condom? Serious health issues for both you and your unborn child might result from having sexually transmitted infection during pregnancy. If your partner has sexually transmitted infection, stay away from anal, oral, or vaginal sex. Make use of condom if you have intercourse with other people or your partner does. And when you have a new partner while pregnant, make use of condom. Your question may also be, is it even inappropriate to have sex during pregnancy? The uterus may contract as a result of sexual activities or an orgasm. Usually, this is not cause for any problem. However, your doctor may advise against having sex if you are bleeding per vagina or amniotic fluid seep out of your genital, or if the cervix begin to open early, which is called cervical incompetency or cervical insufficiency, or if the placenta, your baby placenta covers your cervical opening, which may be partially or completely, which is known as placenta previa, or if you have history of preterm labor or preterm. Your own may be, what if you are not interested in having sex? That is all right. You can feel too exhausted for sex or experience nausea, or perhaps neither you nor your partner is interested in having sex. Just communicate openly and compassionately with your partner about your needs and concerns. There are alternative methods to stay connected if you don't want to have sex. Try giving a hug, kiss, or massage. That may be okay for you. I've come to the end of this video. Thank you for staying to the end. And until next time, I'm doing another video. Take complete charge of your health.